Hello everyone. So today I wanted to give you a brief about different types of study designs in research and a comparison of these designs, like its advantages and disadvantages. So study designs are the set of methods and procedures that used to collect and analyze data in a study. So broadly speaking, there are like two types of study designs: descriptive studies and analytical studies. So when it comes to descriptive studies, it describes specific characteristics in a population of interest. For example, like case reports. So in a case report, we discuss our experience with patients, symptoms, signs, diagnosis, and treatment. Whereas in a case series, several patients like with similar experiences are grouped. So it completely describes what is there in a specific characteristic in a population. And when it comes to analytical studies, these are basically of two types: observational and experimental. So observational studies are the studies that we conduct without any intervention or experiment. Like we do not give any type of treatment. So in those studies, we just observe the outcomes. Whereas in experimental studies, we give treatments or we conduct experiments or give interventions. So when it comes to observational studies, that include many subtypes. So I'll discuss the most common design ones. The first one is cross-sectional study. So this design is transverse, where we take a specific sample at a specific time without any follow-up. It just allows us to calculate the frequency of disease or the prevalence. How much is the prevalence of a disease or the frequency of a risk factor. So it is very easy to conduct. For example, like if you want to know the prevalence of diabetes in a population, we can conduct a cross-sectional study, and whereby we take a sample from the population and just calculate the number of patients with diabetes. So that's how easy it is. Now, when it comes to another one, that is cohort study. Cohort study is a type of study which we conduct by comparing two samples from the population. So one sample would be having a risk factor, while the other would lack this risk factor. So it shows us the risk of developing the disease in individuals with the risk factor and compared to those people without the risk factor. So we can approach like this study in two longitudinal designs. For example, the first one is prospective. So we follow the individuals in the future to know who will develop the disease. So we have a population who has exposed to this risk factor and a population who has no exposure to this risk factor. And then we follow these individuals in the future to know like whether how many of these people who had exposure to risk factor will develop the disease and how many of these people who didn't have any exposure to the risk factor will develop the disease. So that is a prospective cohort study. Now, when it comes to retrospective cohort study, we actually look to the past to know who developed the disease. For example, like using medical records, the patient's medical records who have developed the disease, we'll be looking into the exposure of this risk factor of these people who have developed the disease and who may not have developed the disease. So this design is actually the strongest among the observational studies. For example, like if you want to find out the relative risk of developing chronic obstructive pulmonary disease among smokers, we take a sample including smokers and non-smokers, and then we calculate the number of individuals with COPD among the both. Now, the next type of study is case control study. So we conduct the study by comparing two groups. One group with the disease or the cases, another group without the disease or controls. So this design is always retrospective. This always happens. We look into the past. So we actually aim to find out the odds of having a risk factor or an exposure if an individual has a specific disease. It is relatively easy to conduct. For example, like if you want to study the odds of being a smoker among hypertensive patients compared to normal people. So to do so, we choose a group of patients diagnosed with hypertension and another group that serves as the control or having normal blood pressure. Then we study their smoking history to find out like if there is a correlation. So likewise, these kind of studies happen. Now the next one is experimental studies. Experimental studies are also known as interventional studies. So this can actually involve animals or humans. When it comes to preclinical trials, that involve animals. When it comes to clinical trials, those are experimental studies involving humans. So in clinical trials, we study the effect of an intervention or a treatment that we give compared to another intervention which was already there, or we just don't give anything of that sort, or we just give a placebo. So as an example, like there are like 4 phases for a drug trial. The first aim is to assess the safety of the drug. Is the drug safe? The second one is to assess the efficacy of the drug. Does the drug work? The third one is if the drug is better than the old one. So is it better? And the final one is to follow up to detect the long-term side effects. Like can it stay in the market? Like that. So for this, conducting these studies, the designers randomized controlled trials, where we have one group of participants which receives the controlled drug and the other receives the tested drug or the intervention that we want to test. So those studies are the best way to evaluate the efficacy of a treatment. So thank you so much for your patient listening. I hope this helped to understand basic types of study designs that we commonly use in research.